The following is a presentation of the Healthcare Facilities Network.
Hello and welcome. I'm Peter Martin, President of Martin Associates. Thank you for clicking on this video. Today we present episode 1, two-parter, called What is Compliance? We have our roundtable format. We have 3 facilities professionals from across the country who work in compliance. They've gathered to talk about what is compliance, to talk about the types of employees who do well in compliance, to talk about the role of compliance with the patient experience. Now, if you work in healthcare facilities management, you probably know the answers to what is compliance and what does a compliance professional do, but I also think that you'll probably learn a thing or two by listening to these 3 professionals. And if you don't know what compliance is in healthcare facilities management, well, this episode is for you. As you know, the goal of the Healthcare Facilities Network is to promote that opportunities exist. Professional opportunities exist, and a lot of opportunities exist in compliance. And you'll hear about them as we release this 2-part episode. I want to show you this one career path. As you know, here at Martin Associates, we also perform recruiting for hospitals across the country. And I pulled this one specific career path. Now, there are many I could have chosen, but I pulled this one. This is an actual career path that a compliance professional took, or somebody who worked in compliance took. And you can see it's varied. You know, if you work in compliance, you can stay in compliance. You can go over to Director of FM, Director of Facilities Management. You can go back. So you can see that with this particular career path, you know, this person started from the bottom, working their way up. They were a security specialist, non-healthcare. Then they made it into hospitals. They worked in the MEP trade, so they were a tradesperson, the exact type of person that is not coming into healthcare facilities management. So if you see MEP, if you know, that's mechanical, electrical, plumbing. From the MEP trades, they continue to work their way up to a safety officer in a hospital. Then they became a manager. Then they became a director. And then they went to a director of safety and compliance. So you'll see this one particular person, and this is an actual resume. Names are changed, names are withheld, but you can see they did a lot in their career, and they had lots of different options. This facility, as you may see there, was a 750,000 to 1.5 million square foot hospital. So I show this career path only to illustrate that if you get into healthcare facilities management, if you get into compliance, there are many career paths available to you. So it's a great field to get into. Compliance has at its core the safety of patients, their families, the people who work in hospitals. So I encourage you to watch part 2 or episode 1. I encourage you to watch episode 1. Episode 2 will be coming at a later date. So with that, let me introduce my guests in this particular roundtable.
Hello, and welcome to the Healthcare Facilities Network. I'm your host, Peter Martin, President of Martin Associates. As always, I thank you for clicking on to our network. And I'm very pleased to be joined today by 3 distinguished guests. As you may or may not know, the Healthcare Facilities Network is formed to increase the visibility of this role, to promote this role, to hopefully work with younger people, mid-career people, older people, to get them interested in this field. And one of the buckets, or one of the areas of information that we want to have on the network is relative to compliance. And that's the focus of this particular show. Now, our goal is not to do compliance training like you can get from ACHC or like you can get from a number of different organizations that do great technical training. Our goal with our little compliance roundtable here, and it's the first episode in our compliance bucket, so I'm very happy to knock off another playlist, another bucket with our first video. So our goal with this one, with this particular issue, and this is why my 3 guests have kindly joined me, is to talk about what is compliance in a roundtable fashion. So it's a very simple goal for this particular video. I would like my 3 guests to introduce themselves because they can do a much better job than I can. So we're going to go to Patrick first. Patrick, please go.
Awesome. Thanks, Peter, for having me and for letting me be a part of this Healthcare Facilities Roundtable compliance video. So my name is Patrick Rhinehart. I'm a Director of Compliance or Fire and Life Safety for Northside Hospital in Atlanta, Georgia. I've been in healthcare for about 10 years. And in a previous life, I was a firefighter, EMT for about 7 years. Left the fire trucks and got into the fire marshal's office, did some fire prevention, plan review, inspections, took a nosedive into code compliance and got on a couple of NFPA technical committees, NFPA 241, NFPA 99, and finished my associate's degree in fire science, bachelor's in occupational safety and health, master's in occupational safety and health, and then actually I just started my MBA in healthcare administration Wednesday. So continuing education is a big part of compliance. But from an introductory standpoint, I've been in healthcare for 10 years, been promoted several times, been given a lot of additional hats along the way. I've grown a department from, me, single life safety specialist individual doing semi-annual environmental care rounds to a department of 16 people, overall aspects of environmental care and life safety for about 9 million square feet. So 5 hospitals, 52 medical office buildings, 22 surgery centers, and then hundreds of practices and cancer centers, imaging, across half the state. So pretty busy in facilities and construction, engineering. And so, yeah,
Excellent.
I enjoy it.
Patrick is one of those guys, and I did a podcast with Patrick probably 18 months ago, but like a lot of folks in healthcare facilities management, that they're in the office early. So we'll occasionally, I know that Patrick's one of those people I could call at 6 o'clock in the morning and he's going to pick the phone up, because you usually start 5:15 or so, you can get emails that early from you. So
Yeah, I don't like traffic. Well, I get to my desk between 5 and 5:15 every morning. Yeah. So about a 30-minute commute. So yeah.
Excellent. Patrick, thank you. Michael, how about you?
Hey, good morning. And yeah, thanks, Peter, for having me in this distinguished group.
Absolutely.
I am Michael Gorham. I'm Director of Facilities for Children's Hospital of Wisconsin. And we're kind of a unique organization. We have a main campus in Milwaukee, a 300-bed, 2 million square foot facility. But then we also have a footprint throughout the entire state of Wisconsin. So hospitals within hospitals. So we have a floor here, a wing there, a freestanding building. So about 6 million square feet around the state, and dealing with compliance with other healthcare entities and merging their data into my data is always a fun and unique adventure. Also, I am a part-time life safety surveyor for ACHC, formerly known as HFAP. And so I do 5, 6, 7 life safety surveys around the country every year. And that's something that helps keep me sharp and helps me share information and best practices with other facility folks from around the country. My background, I was an electrician by trade, and just like a layer cake, I started building my career and got into I was working for a school system, and that's when I started working on fire alarm systems and repairing those and learning the codes, and then moved on to healthcare, and then started adding state and local rules and learning about all this, CMS compliance stuff. And so just over the years, adding more fruit salad to the end of my name, I have enough initials to choke a donkey. So like Patrick, just continuing education all throughout my career and building that cake to what I am today.
Excellent. Not to pick on you, Michael, because I know that, I first met Michael probably 6 or 7 years ago now, when Jack and I did a education session before one of the ACHC annuals. And Michael was great to have in class because very participatory from the start. And as people know, in healthcare facilities roles, it takes a while for people to get comfortable and start to answering, and you always get them there by the end of the class. But Michael was one of those go-to guys you could go to right at the beginning, because you were always willing to kind of give your background and speak. But I worked with a guy, his name was Kurt Lamar, and we were building, it was a continuing care retirement community. It was one of the best construction projects I ever worked on because a healthcare component, it was greenfield. It was just a great project. There was no existing, but we used to joke, Michael, and when you said this, it made me think of it. On Friday afternoons, Kurt and I would always joke about all the people we'd get emails from who would have these initials after their name, and we would just make stuff up because you would see everything, the MBA, FA. So it's funny that you mentioned that. There's nothing wrong with initials, but sometimes it also provides some good humor. Anyway,
Yeah, my master's degree is from University of Arkansas in operations management. So the acronym is MOM. So actually it's MSOM, but I've been called the mom before.
Well, thank you, Mom. Craig, to you, please.
Well, unlike my other distinguished guests here, I'm the invisible man that always stays in the background. So, technology
very
is
good.
great. Yeah, technology is always great, but it doesn't always seem to work when you want it to. So, I am the director of facilities for the Southeast Georgia Health System in Brunswick, Georgia. Been here about 3 years. Prior to that, I was the director of facilities and biomed and dietary and whatever other thing they could give me at a small hospital in Vidalia, Georgia. I like to introduce myself by saying, I am Canadian by birth, American by choice, and Southern by the grace of God. So my background includes, I served 15 years in the Canadian military and took early retirement. My wife is from Vidalia, Georgia. It's another story how we met, and moved her to Canada for 5 years, and then we had to come back and thaw her out. So I'm an instrumentation and electrical technician in the military. I got into healthcare haphazardly. It was looking for employment. I was working for a luggage manufacturing company, doing logistics, and then 9/11 hit. So there was some setbacks there. And then I started to work for the hospital as a grant administrator, and then worked my way up into facilities, and been there ever since. I am also an independent life safety, environmental care, emergency management consultant with BBRN Healthcare Incorporated, which is a small company that was founded by a lady that I work for now, Miss Betty Baxter. Right now, we are currently in contract with 3 health systems throughout the country, and I do the life safety, environmental care, emergency management for about 15 hospitals routinely. Nice. Yeah. So that's about it.
Well, thank you. And I never knew that about your transition from 9/11 to healthcare facilities management. Follow up on that. But I picked these 3 gentlemen for a couple of reasons. Number one, you've just heard very varied backgrounds, very committed to compliance. And also it's very important as well, as I said to each of them when I asked them, all 3 of them can talk, which is very good. And they're all very, very social. And so that's always a key. You don't need to hear from me, you need to hear from them. And so I appreciate the 3 guys joining me today. Let me just start with a really basic question. And Patrick, I'll direct it towards you if that's okay.
Sure.
In your eyes, what is compliance?
Compliance in healthcare.
Yes, compliance in healthcare. Thank you.
Yeah. Compliance in healthcare is, a multiple head monster, and it depends because, compliance can be, with a local AHJ, city, state, fire marshal, or it could be with the federal, compliance, CMS, or like Michael, ACHC, or AAA-HC, or DNV, or blah, blah, blah.
And there's a lot of acronyms there that Patrick just put up
sorry.
there. And no. And that's actually part of kind of like learning compliance, right? Relative to if you're somebody looking at it, it's acronym city. And so one of those things to do is to, maybe if you're brand new, write those acronyms down and figure out what they are. We won't go into it only because it would just take us forever. So please continue, Patrick. I'm sorry.
No, you're fine. So yeah, I mean, it's a lot of vegetable soup in there, but I think for compliance, for someone looking to get into healthcare compliance, you need to know you need to know whose jurisdiction you fall under, is an easy way to say it. So, and then, you're going to most likely fall under a couple different jurisdictions as a hospital. So you need to know, which side is more stringent.
When you say jurisdiction, Patrick, can you give an example of what a jurisdiction might be?
Sure. So in Georgia, jurisdiction for the hospital falls under the state fire marshal's office purview. So it is not, while this hospital across the street from me resides in the city of Sandy Springs, its design and occupancy classification and construction, plan review, new construction, new renovation type stuff does not fall under the city of Sandy Springs Fire Marshal's office. It'll fall under the state fire marshal's office and then also the Department of Community Health. And so that's really important to know because the city of Sandy Springs, in Georgia at least, counties and cities are allowed to take the minimum code requirements, the life safety code, and they have to meet the minimum, but they are allowed to impose more stringent code requirements on their jurisdiction. So, knowing that you fall under the state or under the city or state, city or county, is an important start, right? So that's that part for jurisdiction. So need to know who you fall under. There's environmental compliance. There's different, code books to follow. There's Joint Commission compliance. So without getting off on a tangent, like Peter said, we could talk for probably a couple of hours on jurisdiction and what's required, but compliance in healthcare for me, I kind of wrote down, so I won't take up the rest of the guys' time. Hang on. There we go. Compliance.
A design feature.
Yeah. For us, I have a whole department. My department is the life safety and compliance department for the system. So for compliance for my folks, I kind of just went through each of their positions and just wrote down just a few topics off the top of my head that might help spark some more conversation. But as a specialist, right, we do inspections, drills, we do pre-fire department planning, fire warden classes, we do multidiscipline rounding with a bunch of different departments in the hospital. We do more top-down inspections, which is just an added blitz of inspectors for a whole hospital. We do above ceiling permitting, obviously continuing education, construction inspections. For our coordinator over those specialists, they're doing an invoicing, data entry, their supervisor role. They also have continuing education. Analysts, so we're over all of the life safety systems, inspection, testing, and maintenance for about 140,000 devices across our system. So all of the scheduling, that goes into that to meet Joint Commission windows, all of the repairs, the contracts, and let's see what else we got here. Managers. So, we have infection control, risk assessments, pre-construction meetings. Let's see, construction plan review. We do a lot of design, conceptual design, master planning. Like I said, we have 9 million square feet in organization. And when I started, we probably had less than a third of that. So in the last 10 years, we've more than 200% grown. And I think a lot of healthcare systems in the country are that way too. So construction is a huge part of compliance, not just meeting the codes and standards, but yeah, I could probably talk about another 20 minutes on each one of those, but kind of hard to put an umbrella over compliance.
Absolutely. Michael.
Yeah, I think Patrick did a great job talking about the who and the how. And what popped into my mind is why? Why do we do this? And it is to operate a safe facility, safe for our guests, our employees, and a safe environment for our patients. And so as he's talking about all these different codes and stuff, you look at the root of these, the NFPA 101, the life safety code, is basically an entire book that tells you how to get out of a building in an emergency, right? The whole thing is designed to show you how to egress a building. NFPA 99, specific to healthcare facilities. So that's another great code for newer folks to be looking at. But yeah, just the why was what popped into my mind. We could talk about the who's looking at us all day long, because we've got local fire marshals, state health inspectors, I don't know, anybody else that decides to show up that has a shiny badge that makes my pager go off. So at the root of it, we want to create a safe environment.
Let me ask you a question, Michael, and Craig, we'll get to you in a sec if you don't mind, but you've worked acute care hospitals for, adult side, the whole gamut, and now you're at a great hospital in a great city where you're a children's hospital. Relative to compliance in the environment you are now versus your prior jobs at acute care research type hospitals, is there a difference in compliance? Do you notice? I mean, granted, you're there to protect the patient and their families. That doesn't change, right? But is there a difference between where you are now and where you've been?
No, I mean, code wise, it's an acute care hospital. We are managing and tracking compliance with, all of the different authorities having jurisdiction in the same exact manner. It's just delivered here a little softer for the kids.
And that's kind of where I was given your patient mix. And
yeah, and I've been here 3 years at Children's. I've been in healthcare 20 some years, but the culture of a children's facility is so much nicer. So for anybody newer out there, it's always culture eats chaos every day. So it's a great place to work.
Yeah, well, you bring up the culture, and we talk about that quite frequently. In the recruiting part of what we do. Every hospital has a unique culture, and so you got to make sure when you take those roles that the culture is a fit for what you want, because you're not going to change it. You're going to fit in. Craig, how about you?
Well, I actually Googled what healthcare compliance definition was, and
what'd you find?
It is the practice of adhering to federal healthcare laws and regulations which prohibit and prevent fraud, abuse, and waste in the healthcare industry. And it was founded under ethical standards for patient treatment.
Can you read that one more time?
Yeah. It is the practice of adhering to federal healthcare laws and regulations which prohibit and prevent fraud, abuse, and waste in the healthcare industry. And it was founded under ethical standards for patient treatment. And it's not only in place to protect patients, but it's also in place to protect your healthcare workers and our staff. So for me, compliance is a roadmap or a means to garner trust. So, our patients want to trust that the establishment they're coming to for their healthcare is doing the things right and doing all the things necessary and are compliant with what is out there to be a safe environment. So to me, it's about establishing trust, and that's why we do compliance. I don't know if that makes sense to anybody, but for me, that's what it's about. I want people that come to this facility to trust that we're going to do what's right for our patients and our staff, and that we do that not only because we're regulated to do it, but because we want to do it. And that's probably why I'm in compliance. I love being involved in treating of patients. And as a facilities guy, we look at, are we involved in the patient care? Well, we probably impact patient care outside of a doctor and a nurse, probably more than anybody else in the healthcare industry. I mean, we deliver the power to the instruments or whatever we need to do. We deliver the med gas should it be required. We deal with the plumbing and water systems. Those are just things that nobody really pays attention to because they're always there, but somebody has to look after those. And I think that's why I do it. I want to teach people why we do the things we do. And I think that to me is why I'm in this business.
Michael, you looked like you were going to say, I want to give you the opportunity, but you're going to kind of jump in there for a sec.
Yeah, I would, yeah, exactly where Craig was heading with that. We're pigtailing the trust of that we're operating a safe facility for people to trust us with their family members. So it just kind of dovetails together with what we were all talking about.
I thought Craig, thanks for looking up that definition. You've actually shamed me. I probably should have looked that up, and that would have been a great intro. So nice job. Thank you. But what did you guys think of, I found it interesting, fraud, abuse, and waste were mentioned. Did that, and it's part of it, right? But it's funny, I always kind of look at the patient first as opposed to the fraud, abuse, and the waste. Did that stand out to you guys at all from the formal definition, or what'd you think about that?
I think that, if I could jump in first, just for a second, I think that is actually patient-centered still.
Yeah.
I mean, after listening to Michael and Craig, I know my answer seemed kind of like a textbook.
That's okay.
This is what compliance is. No, but
Okay.
From the heart. But and
Yeah.
I agree with them wholeheartedly. But I think that definition is still patient-centered. Fraud and abuse and whatever the other one was.
Waste.
And
Fraud, abuse,
waste.
waste.
I mean, if you're thinking patient-centered, which I agree with them, most all your compliance decisions, to keep the systems fully functional, to do more than that, performance improvement initiative, blah, 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 things that are more than what's required to provide a safe functioning environment for patient, staff, and visitors. So, yeah, I mean, if you're making patient-centered decisions for your facilities and operations, compliance, construction, then you're in the right place.
Craig and Michael, I kind of direct this towards you because you're directors of facilities management. You're also, as you said, you're also consulting and you're doing your surveying, but you're also responsible for, compliance is a major part of what you do in your daily job as director of FM. What are those demands like? Time demands, and how difficult is it to balance? Because we listened, Patrick said he was very, he kind of listed what to do. That's a lot. I'm sure somebody who's listening to this for the first time, they're like, that you guys do a lot relative to compliance. How do you balance all that and your directors of FM roles on a daily basis?
I'll jump in first here. Back in the day, not too long ago, it used to be really difficult for managing all of this calendars and testing and preventative maintenance work that needed to be done to maintain a facility and maintain compliance with CMS requirements. We've moved into more of a software age nowadays where I have a actual dashboard. I work with a software platform. I don't know if I should mention it out loud by name, but anyway.
It's fine. I mean, unless you have I don't, it's fine with me.
Oh, I forgot the name of it. Let me pull up my other screen real quick.
They would appreciate it.
Yeah. I work with L&R Scout. It's a company out of Nashville, and they built my compliance calendar for the year. So it's a not very expensive platform to work at. And then as we get testing done throughout the year, I have a compliance coordinator, which is also another wonderful thing that that's her life, is to make sure all the testing is done and done on time. If she doesn't have the documents uploaded to the Scout platform, it's a tattletale. It emails me. And so I can call her up and say, hey, what's going on with sprinkler testing for West Tower? And usually it's just a lag in documentation from the vendor. But so that has gotten better to balance that, to go back to your original question, using technology to make sure. And that Scout program has a dashboard, so I can pull up every facility in the state of Wisconsin and see at a glance who's not compliant.
Oh, wow. So software, that's good that technology has worked. You don't always hear successful technology stories.
And when it started coming out a few, 6 years ago, I'm thinking of two or three ACHC shows ago. I don't know. It was really expensive, and these guys were bringing this stuff out, but it was just, off the charts. So the Scout program is based on a square footage of your facility, and it's very reasonable. And then the annual maintenance fee is nothing. So
Excellent. Craig, how about you?
Well, it's a good question. I don't know how we manage it, but we seem to do it. And I give my credit to my staff. The people you bring in around you, you train them in the same way that you would to tell them why you're doing certain things. So like when my guys come in, I tell them, we're doing this because of this. And we impact patient care, which has always been my focus, related to how we treat our patients and how you would like to be treated. But hiring the right people, having the right people in place, getting good managers under you or and staff that can do the work, to me has been beneficial. And making sure they're trained in the right way is what helps me be able to do this effectively. So for me, attending meetings, getting education, those are all beneficial, and bringing that information back to your staff and training them makes my job a lot easier. And then, of course, having a leadership buy-in that supports you in those decisions is key as well. That allows you to be able to bring that to your staff and help out. So for me, it's staff competency and hiring the right people enable me to be able to do what I need to do. So I can trust them to do, what they're trained to do, allows me to expand the horizons of, keeping up to date with everything that's going.
Is there a personality trait that you look for in a person that does compliance well? And if so, what is it? What are some of those traits that you would look for?
absolutely detail-focused human being. The gal I actually hired to be our compliance coordinator did have zero background in life safety, nothing. She was a science major in college, but I don't even know why she applied for the job, but in talking to her, she was just such a detail-oriented person. We educated her when we hired her on and sent her to the boot camps and life safety schools, and she's been here 3 years now and is just a superstar.
Wow, that's great.
We had our last Joint Commission survey, and we had zero documentation findings, and so when she walked in to the exit interview, she got a standing ovation.
Nice. That's great. And you know what? That's a great success story in a time when it's increasingly difficult to find people.
But yeah, like Craig said, having the right people and putting trust in them and letting them do their job.
So detail-oriented person. Any other trait that you guys look for?
Yeah. Well, go ahead, Craig.
I just look for somebody who's willing to learn and wants to learn, and it's not just looking for a job. They want to know why they're doing what they're doing, and that's a key. We can get people to come in here and do the job, but after a while, I think they just get into a routine. It's those people that want to know why they're doing what they're doing that I look for as a key to helping with the compliance and being able to trust them to do what they need to do.
So when I came here 10 years ago and they started to let me grow my department, and I actually looked back at the fire marshal's office where I came from, because a lot of people get into public service, fire, police, EMS, and they have no way out. They have no other branch of employment to really go into, except for, well, I say that in the private sector, a lot of firefighters have full-time careers outside the fire department. But ones that wanted to completely change careers, this was a good out.
Yeah.
And there's fire marshal's offices all over the state. Every county, most cities have their own. So it's a good pool to pull from, right? And in the fire marshal's office, a lot of times there's just what Craig and Michael are saying. There's educated, nice, kind, knowledgeable people who entered the fire service to begin with because they're caring. And so healthcare, I've had really good success in pulling from those places and pulling people who are already code knowledgeable, maybe not in healthcare specifically, but already understand the life safety code and how it works, and all the core chapters and where to go for all that. So that's been great. The detail oriented, of course, in mind for specialists. I basically run like a large internal fire marshal's office, and those specialists are truly special people because they have to be knowledgeable enough to do what they're doing, and then they also have to be willing to get dirty, right? Climb a ladder probably 50, 60 times a day. In some places, like when they're doing the hospital smoke compartment assessments, and then also have to be able to stand up and do public speaking, because we do thousands of drills a year across all 640 plus facilities. Fire and emergency drills are together.
Yeah.
And fire department personnel too, they're called for everything under the sun. So giving that type of training for emergency drills too is also, it plays hand in hand. So that's been my experience.
Thank you for watching this episode of the Healthcare Facilities Network. Please give this episode a like, as it really does make a difference in helping to promote the discipline of healthcare facilities management.